my name is Generos J. Canillo, and today I'm going to do a return demonstration about the sensory assessment. So first thing that we do, we're going to assemble the materials or the equipments first to save time, effort, and then I'm going to introduce myself to my patient. Good day, ma'am. I'm a nursing student, and today I'm going to do an assessment. So, my name is Rose Canillo. May I know your name?
I am Hannah Lydia.
Can you please state the date of your birth?
July 2000.
How old are you?
22 years old.
Thank you.
Explain to the client what you're going to do.
So today, ma'am, I'm going to assess your sensory. If ever you have any difficulties in hearing, if difficulties in smelling, so that a doctor can, after my assessment, I could refer you to a specialist.
Wash hands and observe other appropriate infection control procedures. In this video, I used alcohol to disinfect my hand after hand washing.
So, assuming that we have curtains here, I'm going to close the curtains.
Determine client's history of the following.
Ma'am, naamoy sa imong family history, ma'am, hypertension, hypertension, diabetes. Nakapa-check up na ka, ma'am, sa isa ka ophthalmologist. Naakay medical history about sinuses, wala sa throat, sa hearing, sa eyesight.
Inspect eyes, eyelids, eyelashes, and conjunctiva.
Ma'am, inspect na ko imong eyelids, ma'am, ha?
Also observe eye and conjunctiva for dryness, redness, tearing, or increased sensitivity to light and wind. Refer picture for the normal and abnormal findings. Inspect the cornea and lens. Also ask the client when he or she last had an eye and vision examination by an optometrist or ophthalmologist.
Ma'am, when man imong last time nagpa-check up ka o sa ophthalmologist?
On the right side is the normal findings and on the left side is the abnormal findings. Inspect the pupils. With a pen light or similar device, test papillary reaction to light. Test vision. Ask the client to read from a newspaper or magazine. Used only room lighting for initial reading. Use task lighting for a second reading. Asked about changes in vision, trouble with night vision, or differences in vision with left versus right eye.
So, pwede nimo siya mabasa ang kaning letters na. Isa itawag lang sa ang usa sa pikas na tayo.
F U N C T I O N.
Ang sa pikas mo.
E R A C T.
Ang daari mo mabasa nimo.
Aldosterone.
Ang sa pikas mo.
Osmolality.
Ask the client about small specks or clouds that move across the field of vision.
Ma'am, na kayo nakita ang mga clouds dire.
Sa cornea right eye, nasa block na ba?
Okay. Right eye. Blocked.
Inspect the external ear. Observe shape, color, and hair growth. Also look for lesions or drainage. Perform an otoscopic examination to determine quantity, color, and consistency or cerumen. Since we don't have an otoscope available in our house, I use pen light instead as a substitute. Perform the voice whisper test. This is a functional examination to detect obvious hearing loss. Instruct the client to put a hand over one ear and to repeat the sentence you say. Stand approximately 2 feet away from the client and whisper a sentence.
Ma'am, so atong i-perform ang voice, whisper test ma'am ha. So, lihog na ko, lihog namin mo. Tapos, if naana ko i-solving sentence, dapat imo na siya na
I love you.
okay.
How are you?
Inspect the gums and buccal mucosa for color and consistency. If the client is wearing dentures, inspect them for feet. Then ask the client to remove them for the rest of the oral examination.
Examine the tongue. Ma'am, pwede ni mo mapagawa mo ang tongue. Okay.
Observe the client swallowing food or fluids.
Ma'am, pwede ni mo mainom para lang paano ko imong swallowing reflex.
Test gag reflex. Depress the posterior third of the tongue and note gag reflex.
Now, I have here a tongue compressor for the gag reflex. Ma'am, can you please open your mouth, ma'am?
Inspect the nose for color and consistency. Evaluate the sense of smell. Have the client close the eyes and smell a common substance such as mint, lemon, or soap.
Ma'am, please close your eyes. Na ko ibutang object sa imong nose, tapos can you please identify if unsa ni siya?
Mint.
Unsa man siya ma'am ka? Recognize ka?
Okay.
Test nasal patency. Ask the client to breathe while blocking one nostril at a time.
Ma'am, i-block na ko ang imong pagkasalas na please breathe. Sa iyak ma'am.
Palpation. Palpate the frontal and maxillary sinuses for consistency and to elicit possible pain.
Okay na feel na pain ma'am. Dari ma'am. Ala.
Test sensation to pain, temperature, touch, position, and vibration as you would for a younger adult. Pain. Test pain using a sharp object. Objects frequently used include the point of a safety pin or wooden tongue depressor broken to create a sharp edge. For this, I use the tip edge of the Colgate or the toothpaste. Take care not to puncture the skin and remember that universal precautions require you to discard the instrument after examination. Reaching the sharp point, apply light pressure to the skin at minimum. Test the shoulders, arms, and legs, comparing side to side and proximal to distal area. Light touch. Using your fingertips or wrist of cotton, lightly stroke the skin and determine if the patient feels this symmetrically in all areas tested. Temperature. Usually, if pain sensation has been tested and is normal, there is no need to test temperature sensation. But to test cold sensation, apply the cool tines of your tuning fork to the skin in the areas outlined above. To test warm sensation, use a glass tube or other container filled with warm water. Position sense. With the patient's eyes closed, test his ability to determine the direction of the movement as he moves the great toe upward or downward. When moving a digit, it is important to grasp it on both sides, rather than on the top and bottom.
Can you please say if upward or downward?
This is because pressure sensation in the top or bottom of the digit will help the patient determine position sense, even if proprioception is impaired. Vibration. Test vibratory sense on each side using a 12H8Z or 256Hz tuning fork by placing the vibrating fork on the bony prominence of a finger or toe. Ask the patient to tell what he feels. He should report this sensation as a vibration. Then ask patient to tell you when the vibration is not felt anymore. If there is impaired vibratory sense, test a more proximal bony prominence. With aging, vibratory sense may be diminished or lost in the feet and ankles.
Feel ka vibration na. Nawala na.
After, thank the patient for cooperating.
Now that we're done with our sensory assessment, ma'am, thank you for your cooperation. And now I'm going to do the aftercare for the patient, and also I'm going to all the materials that have been used to the waste receptacle. Now I'm going to do the hand hygiene. And then followed by my findings and documentation. And that would be all for today. Thank you.
Evaluation. Perform a detailed follow-up examination of other systems based on findings that deviated from expected or normal for the client. Relate findings to previous assessment data if available, and report significant deviations from normal to the physician.